In this video, we will learn about cervical cancer. Statistics related, symptoms, risk factors, and prevention.
The main cause of cervical cancer is the HPV or human papilloma virus. HPV is a common virus that can be passed from one person to another during sexual intercourse. Most people get it, but it usually goes away on its own. If HPV doesn't go away, it can cause cancer.
At stage 1, it occurs at cervix. Next stage, it occurs beyond cervix, not to pelvic wall or lower one-third of vagina. Next stage, disease to pelvic wall or lower one-third of vagina. Finally, invades bladder, rectum or metastasis.
In Malaysia, statistics shows that cervical cancer is the third leading cause of cancer death among women. And it also the fifth most common cancer. It is most risky towards women with age over 30 years old. Based on the statistics, it also shows that Indian women have the highest cases for cervical cancer, followed by Chinese and Malay.
The symptoms of cervical cancer are constipation, tiredness, back pain, weight loss, loss of appetite, and full vaginal discharge. The risk factors of cervical cancer are multiple sex partners, HPV virus, immunosuppression, diet, family history, intrauterine device, oral contraceptives, smoking, multiple full-term pregnancies, and poverty.
There are many ways to prevent cervical cancer, such as using condoms, HPV vaccine, and pap smear tests. During pap smear, first they will go through a questionnaire with you. To make a cervical smear, you will lie on an examination table with a bare lower body. The assistant will need a speculum to perform the cervical smear examination. Before the examination, the speculum will be brought to body temperature by warming it with warm water. Then it is brought into the vagina and the speculum is opened. The walls of the vagina are sprayed and the cervix becomes visible. The assistant uses a brush to remove some cells from the wall of the cervix. The brush is put into the cervix through the speculum, where the cells are removed with circular movements. Mostly, this examination does not hurt. You can have a slightly sickly feeling when the speculum is put into the vagina and during brushing. After removing the cells, the examination is done. The assistant will tell you how and when you can expect the results. Sometimes, some blood comes out of the vagina after the examination. That is nothing to worry about. The removed cells will be sent to a laboratory where they will be examined through a microscope for possible anomalies. In case of slight anomalies, a new cervical smear will be performed within a few months to a year. These anomalies can go away on their own. When there are more severe anomalies, further examination needs to be performed and you will be referred to a gynecologist. So, keep calm and fight against cervical cancer. Brought to you by